Good evening, everyone. My name is Ramel London. I'm your host for The Next Step, and this event is designed to support young medics in their journey from university into working life. Now, Wesleyan is a specialist financial company for doctors and, of course, a listening organisation. Students have told us about their concerns as they start their medical careers. So, we created this series of events in partnership with young doctors who wish to share their experience to help you prepare for what's to come. Today, we've got an extra special collaboration for you. We've teamed up with the Royal College of GPs to give you an insight into a career in general practice ahead of specialty training applications opening today. So get involved, guys. We have invited some of the brightest talent in GP to share their experiences. This is where they look at each other like, are we the brightest? To share their experiences of general practice so far. So I'd love to introduce, I'll start with you, Dr. Sarah Bailey. Virtual round of applause. Dr. Thuva Amuthalingam. I said that right? Yes. And Dr. Shamara Mathurin-Charles. We're going to call her Sham today, though. So thank you so much for being here, guys. I'm really excited to be speaking to you. And, of course, we hope you guys at home get involved by asking questions in the chat box. Any questions unanswered will be covered on our Instagram after the event. So today we're going to look at the ins and outs of GP training with topics including choosing GP training, healthy body and healthy mind, and personal and professional network. So let's dive straight in with choosing GP training. Now, guys, we're at all different levels in your career and your profession. So again, this is just gonna be based on your experiences. Feel free to be as open and honest as possible. This is gonna help so many people. So we are going to start by asking the big question, why choose GP? So we'll go in order. Sarah.
Yeah, no problem. So I'm a GP trainee, so I'm in my ST3 year. So I've had a few years of actually doing GP training, and it's just really instilled in me why I wanted to do GP. Yeah. It's really varied, it gives you flexibility, and it allows you to create a portfolio career. So though your bread and butter is seeing patients from day to day, you can develop 1, 2, 3 or more specialist interests. So it's really, really versatile.
That's nice, that's nice. Thuva, how about you?
Yeah, so my name is Thuva. I qualified about a year ago, so I've seen the true side of GP, how it's been in the pandemic, so it's been a quite interesting thing for me. I think quite early on in my life, I knew that I wanted something that was flexible, allows me to take up opportunities as they arise and not have to turn them down because of other commitments. So I think it's come to light, and you know I've lost count of how many jobs I've got at the moment, so clearly it's worked for me.
Wow.
So yeah.
Okay, Thuva, we see you working, booked and busy. Love that, love that. Sham, how about you?
Yeah, so for me, I'm a foundation year 2 doctor, which means I'm in my second year of working as a doctor after graduating. But I've always been an advocate for GP, even through medical school. I was part of my GP society, worked with the Royal College, but the first time I felt like a doctor was when I had my GP placement in medical school. I was able to see my own patients, make a plan, examine them, and from early on, but then that's when I knew this is for me.
Wow, I love that though. I love that you're already forward thinking by joining the societies and just getting a general feel for it, because yeah, you actually opened up an application today, right?
Yeah, so as you mentioned earlier, applications to specialty training open today, and I've started my application already, so.
I love that, absolutely love that. Okay, so in general, what advice would you give to those considering general practice who might be concerned by the changes with COVID? Because obviously, now we're consulting virtually, there's negative media attention, like, you know, it's been very hard for GPs, general practices in general over the last 18 months. So what are your thoughts and advice to give others?
Yeah, it's been tricky, hasn't it, 18 months? And I think that's for everybody, not just those in the medical profession, hasn't it? And I think every profession has its ups and downs, and unfortunately we're in a position where GP is getting some bad press at the moment. And I saw a meme recently that was basically an iceberg, and it was the tip of the iceberg, what kind of the public perception GPs do. Yeah. And then obviously under the water is the rest of the iceberg, what actually they do. Yeah. So I think it's really important things like this that we just say there is so much that GPs do day to day. And though, yes, there is this negative media attention at times, but it's really important that you just patients come first, you stick to your day job and just really get stuck in. And so I think for me, I try to, yes, be up to date with what's going on, but also really my focus is my patients and kind of make sure that I'm delivering them the care that I need to be.
So would you say that, you know, everyone that gets into it needs to just not worry about the fog and the worldly idea, just, you know, do it for reasons?
I think so, and I think it's important to kind of be the change as well and speak up when things are going wrong in your practice. And I know Thuva's got a lot of leadership roles as well that he'll probably talk about that can kind of drive that change as well. But the bread and butter of GP, and for the majority of people going into it, a lot of it will be patient facing and doing what you believe the job to be.
That's awesome. That's awesome. Yeah, Thuva, what would your advice be?
Yeah, I think it's been quite tough, isn't it? I think typically it's referred to, or some people are fearful of the fact that it's going to turn into a call centre profession.
Oh, really?
Which I think it's an interesting term if you think of it. Yeah. However, I will put it to you this way. It affords not just the doctor, but everyone in the country the flexibility. You no longer have to take a day off work to come and get a sick note off the doctor. You just get on the phone for 5 minutes while you're at work and it's come to you on a text. Yeah. That wasn't possible 6 months ago, 2 years ago. It's possible now. So who does it hurt? I can't see who it hurts. Yeah. Yeah. So don't believe the media. The media is there to sell the papers, right? So only bad news sells, unfortunately. Good news doesn't sell. Yeah. People, like Sarah said, what's under the iceberg you don't see. You just see the pinnacle of it. Yeah. What's there on a day-to-day basis. And as a profession, you know, we are well remunerated. Yeah. However, we see 90% of the workload in the whole health system. The hospitals see 10% of the workload.
Really?
And we get the inverse amount of funding. We get 10% of the funding for 90% of the work. Tell me how you can not do any better job than that. Wow. But so my advice is just ignore the media. Be part of the change, because everyone that in the health system that's a leader, they've had some kind of primary care experience and are driving that change, and they are at the pinnacle of the change. So be part of that.
That's awesome. That's very inspiring. And Sham, I mean, you're hearing this firsthand. You sound like you haven't been deterred and you don't want to look at any other, or are you thinking actually there are a few things that I'm not too keen on, and you wouldn't mind actually sharing some of those views as well?
Yeah, I mean, so earlier on when I first started to look into general practice as a career, there were things that myself and some of my friends were worried about when people say stuff like, oh, you're just stuck inside one room. And that was one thing initially I was like, oh, I don't really like that. But then when I did GP as a placement, and when I get to speak to people that are doing it as a career, you learn how versatile it actually is, and you're not stuck in a room. Or if you want to be stuck in a room, you can also be stuck in a room. But how you can go outside of that room, you can work in other departments, you can work in hospitals if you want as a GP, you can work with football clubs and all kinds of things, and it's not just confined to that. I was also nervous about having to know everything about every condition, because you don't know what comes through the door. But now I'm a bit more intrigued by that. And I'd like to see a lot of variety of things, and I can't see myself confined to one part of the body. Yeah,
fair enough. That's really good, a good, what's the word? Open-minded way to look at it, because actually, I can still continue to progress and learn and like upskill as well. So yeah, good on you. I like that. Right, let's talk about a typical week in a GP, or is that a thing? Is there a typical week in GP training, and what does it look like?
Yeah, it's quite variable, I think, and each of us will probably, and you in the future, will have a different experience. So depending on whether you're full-time or less than full-time, then me as a full-time GP trainee, I have 4 clinic days and then 1 day in which I get some self-study time where I might be doing courses or exam revision, or exams to take, and then a half a day of internal teaching. So that'll be with my cluster and with other like-minded ST3s. But then alongside of that, I work in sport as well. So around that, I fit kind of clinics in sport and working pitch side and standing outside in the cold. So for me, my week probably looks really different to even a different GP trainee, and it may well have looked very different to your GP training too.
I was, again, full-time GP trainee, so mine is very similar to yours. But however, now I couldn't tell you what next week is. Every week's different. Just to give you a rough idea, Mondays are my admin day where I fit all my meetings in. for all my roles. I do Tuesday morning, I'm a GP with specialists in dermatology and minor surgery, so I do a lot of clinics for dermatology for the local hospital.
Right.
Tuesday afternoon is my private clinic where I do private dermatology.
Divisions.
Yeah.
Tuesday morning, then Tuesday afternoon.
Yeah. Every half day is different. And minor surgery, aesthetics, or whatever it may come. Wednesday used to be my full day of dermatology, where I used to do dermatology clinics. Thursday, Friday are my GP days. Every fourth Thursday, I am in the board meeting for the local hospital because I'm one of their non-exec directors. Every Wednesday morning, once a month, I train the local area first 5 newly qualified GPs as an educational program. I run one of their programs. And then there's bits and bobs that slot into the evening and the weekends.
I don't know where you fit the bits and bobs.
I know, tell me about it. I'm not sure either. I'm figuring that one out.
Like you said, booked and busy.
Booked and busy. I love it though. It just goes to show, like, you know,
that's what's possible.
It's possible. Not just Beyonce can fit all of that time in a day.
He dances, he sings.
I love it. Okay, cool. That's really, really cool to hear that you're you still have the time to be a mentor, a teacher, and all that kind of stuff, which is great. So, locations. Now, I know you're all in different places. How did you decide your training location? And was this based on where you live, where you wanted to be? Like, how did you make these locational decisions?
Yeah, so for me, I went to uni in Birmingham and I haven't actually left, which actually, I can't believe it myself. When I first came to Birmingham, I was like, oh, I'll come for uni and then maybe I'll go down to London. Right. But for me, it worked out staying in the West Midlands, and I've moved around different hospitals in the West Midlands, but even in one area, there's a vast difference between areas, hospitals, GP practices, so you can get a variation in the population that you're working with, despite staying effectively in one area. Yeah. And I wanted that continuity just because of systems, because of knowing how things worked in the hospitals, and I think going forward as well as a GP, if you know the systems that you're going to be working in, it does make things easier. Yeah. However, I'm sure others are going to move around, and that works too, because lots of the systems are throughout the country that you'd be working with.
That's fair. Thuva, you're in Birmingham as well?
Yeah, so I actually grew up in Croydon.
Oh, no way!
Yeah, and then I went to uni in East London, so, ventured quite a lot further than that. And then I got bored of London, so I applied to Midlands for my junior doctor job. Did my job in Dudley. That was a big shock to the system. Interesting city boy in Dudley. Yeah. But it turns out I loved it. I was like, I'm going to stick around. So I applied for GP training in London. Did my interview in London. I got an email saying it's the last chance to change it, and I was like, you know what? No, I'm going to stay. So I changed it back to Birmingham. So I stuck around, and I finished training a year ago, and clearly still like it too much to move. And I think one of the things that has helped me stay here, or been the reason for me to stay here, is the networks you build in that time. In the I think first F1 year is where you probably form your best friends, isn't it? Yeah, because
Sham's like,
no.
Think about
that. In that time, in my roles and the other voluntary roles that I do, you just build a good network, and that's there to support you. And you just, it's not something you can pick up and move.
Yeah, fair.
And it takes a lot of time for you to rebuild that if I was to move back down to London. So I think that's one of the reasons that's kept me here. And you can't complain. Birmingham's a good place to be.
Nice. Well, Sham, you're down south in Kent?
I'm a South London girl. I was born in South London. My first F1, I went to King's College London, which is in South London, SC1. My first F1 job was at King's College Hospital, where I was born.
Right.
But yeah, I'm in the South Thames Deanery, so I'm in Kent at the minute. And I think I'm going to stay
Sounds
in that
like
area.
You're staying.
I don't really like venturing outside the M25, so I think I'll be staying down there. But as you said, that's where my networks are, that's where my family are, my friends are. So for me, I think that's where I'll stay.
She's a South girl, true and true.
Yeah.
I love it.
Definitely.
No, fair enough. I mean, I guess the network sounds like the big point to think about. So, that's really good for a lot of our young medics to consider as well. So would you recommend choosing a location that you want to stay in long term, or should people move around? Should they see the sites maybe?
Loads of my friends have actually done that. I've moved to London for doing their GP training. I've gone up north, and often it's quite dependent on if they have friends or partners that are in different specialties, and maybe they can only get certain areas, and then they might move for that reason. So there's no real reason you should stay in one area just because big guy. kind of have. But and there's definitely ways and means of moving around. And we were chatting about the variability of locations that you can apply for GP. Applications are open today.
Yes.
Yeah, so it's everywhere. And the areas are really broken up as well. So you can actually apply to a smaller area than some of maybe the other training programs.
That's good. That's nice. That's good to hear. Okay, what would your tips be for the application process? I feel like we're really plugging this today. What would your advice be though if anyone was struggling? And maybe Sham, you might see something that you notice and you're like, actually, might need a little more time to prepare for that.
So actually the GP application is actually quite straightforward. You just fill in your normal demographics, your eligibility criteria such as like your university degree, your GMC number and stuff like that. And there is just one simple white space question that asks, why GP? So that might take some people some time to think about, but I think if you're applying for it, you're going to know why, whatever reason you're applying for it. It's just 200 words, so I think, so the application is quite easy, simple to get done.
Any tips for people who've done the application and actually got to the next stage? Was there any, I don't know, because like back in the day when they'd say, do a cover letter that will really impress them, write down all of your accolades. I've done the Duke of Edinburgh Awards because that helps.
Exactly.
Like, are there any special things that you should add that kind of make you shine? I don't know.
I think with the white space questions, it's designed to make it as uniform as possible, so there's less discrimination and encourages diversity and things like that. So that's why I think the process has been simplified over years to be what it is now. And then, of course, subsequently you would have the MSRA specialty assessment exam, which will again further determine who gets through first round, and then all the rest of you will go for interviews. I think that's probably where people need to focus the most time.
I think this year, if I'm correct, there's not an interview because of COVID and stuff. There's still...
They did the same last year, didn't they? They got rid of the interview side of things and just kept the kind of multiple choice MSRA stuff.
Thuva's like, what?
I love that.
I would love an interview. I think I really sell myself better at interview, but it's understandable in the times. No one really knows what's going to happen. You know, during the interview time would be in winter time, and obviously the NHS is in crisis essentially, and it would be hard to get people out of work. And if you're sick, you can't really make an interview. So I understand.
Fair enough. That's good insight. Thank you for that, guys. Thank you. Okay, so all three of you are developing what we call a portfolio career, where you've different special, or maybe they're difficult, different special interests outside of your regular clinic time. So talk us through how you each got into your special interests.
So I actually started my specialist interest slightly later than many. Like lots of people at university would be part of ENT stock or sports medicine stock and lots of different societies. And I really wasn't sure. I started my F1 not knowing if I was going to choose GP or whether I was going to go into A&E, and I just wasn't sure. And then just really sought really as many experiences as possible. And one of those was volunteering and building a network again at a local rugby club. And then that's basically where my career in sports medicine has kind of taken off from. So getting to know different people and at the start just kind of volunteering. And then now that's kind of developed into a proper job role. I'm now working across different up to international level sport, and it's absolutely amazing and I love it so much. But I think my side of things, I always think to say, don't worry if you're not sure what your portfolio career is going to be, because actually, if you do know, brilliant. Some people knew were going to be brain surgeons when they were 12. Wasn't me, but but they do. And if you don't, then actually GP is a really good career for that, to kind of give you the option and the time and space to explore those. But yeah, so I just developed it over a number of years, and then am now doing part-time in sport, full-time in GP, and trying to stay fit and healthy in the meantime.
Wow. Well, the gym medic is doing her
She's
thing.
alive.
I love that. I love that. Check her out on socials, by the way. Thuva, how about you?
I think it's an interesting question. First thing I'd say is when you talk about portfolio careers, everyone assumes clinical roles immediately. Remember, there's a ton of non-clinical portfolio careers as well, not just limited to leadership, whether that's NHS England or outside of the NHS, but also other things like education, medical education, and things like that also come into play. What I would say from my experience is in med school I wanted to be an orthopedic surgeon, and I was like, yeah, that's going to be me. And then I did my house job, and I was like, Maybe not. Maybe not. Thank you. So, so I'd done a lot of surgical stuff, and I know I wanted to do lots of hands-on stuff. That was still something I was really passionate about. So I thought that's how I got stuck into aesthetics, doing Botox fillers while I was in training, actually. Not that I should be saying this, but anyway. And then that developed into the gypsy dermatology role because I had done that experience, and I, learnt a lot about skin, and I was already doing bits and bobs about it. And then that fitted nicely in with the gypsy dermatology role. And of course, because of what I'd previously done, I had some basic knowledge as to the simple dermatological conditions. So I had what you could technically call a bit more in-depth understanding, so that it was easy to build on. And then that just led to the job I got in terms of the fellowship, dermatology fellowship. That's probably what got me the fellowship, I'd say, in fact.
Wow,
and
that experience.
Yeah, exactly, because you've already demonstrated interest, and you've demonstrated that that's what you want to do, and commitment and things like that.
Yeah.
And of course, there again, I built on that, and I was able to take on the lead role for the spa, for Medical Spa, etc. And that's where we are today.
Amazing, amazing. So Sham, have you thought about special interests and your portfolio?
Yes and no. So outside of sort of medicine, my other two passions are teaching. So you mentioned medical education. I do a lot of teaching for the medical students. I've developed some programs for them. And the other side is sort of working in BAME issues, trying to decolonise the curriculum, work on allyship for black and ethnic minority GPs. I've been doing stuff with the college for that. So those are the two kind of things I'm into at the minute.
Awesome. That's really inspiring as well. Thank you. It's good to hear that you're all doing such different things, but you are going to be specialists in all of these fields. So that's awesome. Okay. So obviously the big theme is why GP. What do you think the future of general practice is looking like right now?
It's interesting, isn't it? Because it's been the same for many years in that the consulting style. And though there's been a lot of apps and the internet to change things slightly, COVID and the pandemic has really pushed us towards using and utilising those different apps or programs. So I think it's going to look different. I think it will probably be a bit more of a hybrid kind of setup with remote consulting, video consulting, but also face-to-face consulting as well, because that's really important for a lot of people. And there's lots of people, we were discussing it earlier, sometimes if I need to have a quick chat to the GP, I'd rather it just be on the phone because that works for me, but for others, a face-to-face would work better. Yeah. So I think it really is going to change, and the landscape will change, but I think for the better. Definitely.
That's good. That's positive. Thuva?
Again, I think what Sarah says is absolutely right. Trust me, it's easier for me to see you face to face. I can probably do the job in 2 minutes rather than 8 minutes on the phone.
Right.
So I'd rather see you face to face, but there's a reason for what works for who and etc. In terms of how much is it going to change, I think a lot of the change is happening now, and most of it is probably already done in terms of the hybrid nature of how we would consult in the future. Yeah. I think in terms of the changes that will come would be, one, in terms of the funding constraints the general practice is under right now. And I think it's great to see what the BMA is doing right now in terms of pushing for what we need in terms of their more funding for the amount of work we do. I think that will make a big difference. Secondly, because there's been a massive recruitment drive in terms of getting training program directors to have more spaces for GPs, to recruit more GPs for the country, because we need it.
Yeah.
We're stretched. Yeah. If you look at the other countries that are doing well in terms of primary care, they've got probably 3 to 1,000, where I think we've, don't quote me on this, I think we've got about 1 to 1,000 or less than that in this country. So that's how many GPs we need. Okay. Yeah. So things will only get easier, in my opinion, I think. Yeah. Once we've ridden the COVID wave, and then we've still got to ride that wave as well. We're still on there. I think once we get through the backlog in terms of hospital treatment and things like that, it will ease off on primary care, because we are the front door. As much as the media will have you believe it otherwise, we are the front door of all the health services. Yeah. Who do you call when you need something, whatever it is? If it's your consultant, you don't call it consultant, you still call it GP, because your consultant ought to call it GP. Yeah. I would like to see them to come and just sit there and do that job one day. They can't. They wouldn't manage. So I think it's not a job that's going away anytime soon. Yeah, no computer can replace a GP. Oh. Yeah. They can be a decision aid. Yeah. They can be a consultation aid, and definitely that makes a difference. I do e-consults in a minute, when they're appropriate. Yeah. But sometimes they need to become a face-to-face or even a phone call conversation. So it's a mixture of things. And I think the other thing that PCNs and how the landscape is changing in terms of how the NHS is laid out, it's going to determine how we practice, is that it's going to let local decision makers and local healthcare professionals determine what the population need in that area, because it's quite different everywhere. Yeah. So I think all these things are good. but we just need to wait to see them come into fruition.
Yeah. From a you're not quite there point and perspective, Sham, do you feel like there is a big future for general practice? Is that what kind of excites you about wanting to get into it?
Yeah, I think so. And just like, I agree with everything they both said, and also stuff like the introduction of different allied professionals in the GP practice, like pharmacists, can sort out the prescriptions, and that gives the GP more time to actually do their job and deal with their complex chronic patients, acute patients. And I think once the money starts coming in, appropriate funding for GPs, then everyone will be able to do their job properly. And I think we're getting there, but obviously COVID did come and stomp over a lot of things, and once we get through that, I think we'll be able to go in the same way that we were going before.
Yeah, that's awesome. Thank you, guys. The future of general practice is still in good hands. Like it. I like it a lot. Right, let's move on to talk about you guys. Let's get a bit personal, not too personal. Healthy body, healthy mind. So this is about keeping a healthy body and mind for yourselves as a part of, dealing with the pressures of work and just being yourself, being healthy, enjoying your life. So how do you stay physically and mentally fit? This is in general outside of when you have the time, Thuva. How do you look after yourselves? I mean, even training, being a student, for everyone, what does that look like?
That dream of a work-life balance, right? I always go on about it, don't I? Yeah. And I think it is really important, but also it's not an end point. Right. I've found so many times over my career, I felt like, wow, I've got this down, I'm exercising, I'm eating well, and I'm seeing my friends, and my job's going well, and then something will happen, whether it's a new job, a training program, and that work-life balance that you prepared, gone, and you just think, all that work that I did. But I think if anybody says that you'll always have a perfect work-life balance, I think it's wrong. I think it's something that you always have to work towards, and be really mindful of. And though I think 10 years ago I'd like to think, oh yeah, I understand what I need to do to look after myself. Gosh, did I? No. Yeah. So yeah, I think it's really important to be aware that you need to fill up your own cup first before you're giving out to people. But equally, having flipped that around at stages in my career where I felt like I'm running on empty and you just have to keep going, it's also really important to have a network in place to support you, to be like, keep going, you've got this. What can we do to help? How can we support you to make sure that other people are topping up that cup to make sure you've got enough to give? So it's difficult, and it's a work in progress always. Oh, yeah. But if you know that and you can work towards that, I think that's the most important thing about keeping healthy.
That's good. I like that. I like keep your cup full. Yeah.
Keep it positive. Keep a smile on your face. Keep positive even in adversity. You try.
I love that. Thuva, how about you?
No, I think that's you hit the nail on the head. Keep your bucket full, isn't it?
Yeah. The question is, when do you do this?
That's a very good question. So again, like Sarah said, it's a cyclical process, isn't it? You go through peaks and troughs. You go through a stressful time, and then you're like, okay, there's too much on now. We need to slim down. You slim down. And then a couple of months later, and then you're like, we're back to square one again. Yeah. So it's a continual process of evaluation, isn't it? I think the other thing Sarah said that's important is I work on a concept of you first, your team second, then patients third. Okay. Whether you like it or not, sorry. Okay, because if you're not well in yourself, you can't look after anyone. Yeah. If a team's not well enough to get the patients through the front door to you, no one can get care. Right. And then only can you get patients looked after. Yeah. If any of that falls behind, then
got problems.
Yeah, we've got big problems. That's the way I work it. And what do I do to de-stress? I guess just see friends, go out, a little bit of hiking now and then when I can fit it in.
Nice.
Bits and bobs.
There's an interesting thing I was talking about in training called housekeeping, and it's basically a way of, if you've had a difficult consultation or you feel like you've taken on a lot, is actually acknowledging that and being like, okay, that was actually really difficult. I need to actually spend 2 really valuable minutes popping to the loo, getting a cup of coffee, doing something that can just clear your mind so that actually that next patient is getting the care that they really need. Yeah. So that's the other thing as well, having the insight day to day in your clinical practice that you're looking after yourself as well. Because I was in my F1 year, and I'm obviously COVID's hit, but I would literally burn myself out, run myself to the ground, go on holiday, feel like, things are fine now,
Yeah.
and then go again. And I really do feel for you guys that have not been able to travel or do different things over lockdowns, etc. It's been work, and it's not sustainable. And I see that in hindsight now, and I think the pandemic's taught me a lot about that. But that's why it's important to keep in touch with yourself and know what's what.
Yeah, that's good. That's good. Sham, how about you? How do you make time for, I don't know, physically, mentally looking after yourself?
I don't really make time, but
She's like, I'm busy.
I have. So Thuva mentioned finding your people in F1, but I really found my people in medical school. So my friends I had on the first day of medical school are still my closest medical school friends now. And they really check me. They'll be like, okay, you're not acting like yourself. What's going on?
Right.
So I think having those people that know you and can say, something's not right, you need to stop.
Yeah.
Is the way that which it's not good to rely on other people all the time, but it's good to have people that know you and can tell you when you're not you.
You've answered my next question, because it is, who do you go to for support when times are hard? So it sounds like you have a great tribe around you, amazing friends that can spot that you're not okay. How about you two? Do you have people you can lean on?
No, you go for it.
Okay, first. Family for me is a huge one. No one in my family is medical, so in a way it works both ways. In a way, sometimes that's exactly the listening ear that I need, but also sometimes it's absolutely not, because it can be something that I feel like maybe one of my medical friends might be better to chat to about, but also, what I've learned, as much as I thought my job was stressful, every job is stressful, and that is the grounding that my family have always given me. They've been like, this is really tough, you can do this, how can we help? And like you said, it's that tribe support network that really are you people. I found my people in med school, F1, probably as well, so a bit of both, but whether they're school friends or whatever it is, as long as you've got people around you.
Yeah, definitely. Thuva, how about you?
Yeah, so one of the things that I took away from what's called the Next Generation GP program, it's a leadership program for GP trainees and GPs, is from one of the executive coaches that used to coach us. His name was Oliver. He says, he taught us the concept of having your board of directors in your mind, the people that you go to when you need to run a decision past. So every time I'm thinking of applying for a job or wanting to let something go or have a tough day, there's a certain people that you go to for certain situations.
Yeah.
There's people who, you got a critical friend who'll critique everything to every little bit. You need them when you don't want to do something, when you be told not to do it.
Yeah.
And then you've got obviously someone who's got a holistic view or chilled back view.
Yeah.
There's that person that you go to, and there's someone you go to for financial advice, for example, and there's someone you go to for just some pastoral support, just to de-stress, and someone to talk to really. So that sort of board of directors in your mind of your own family or friends it's an amazing idea. And yeah.
That's really cool. I love that.
Right?
Because the board can be
I'm now thinking, who is on my board?
Who is my board?
Who is my critical friend?
That's so funny. That's a great
really
way.
good idea, actually.
Yeah, great way to
Thanks
see.
to Oliver.
Yeah. Thank you, Oliver.
Thank you. The other thing to say as well is, if you've moved to a new area and you do feel really isolated, because there was a couple of GP trainees that moved from Scotland into our area right in the middle of the pandemic, didn't really know anybody, and that kind of GP cluster was really good for them. Also your supervisors and junior doctors kind of forums and messes as well are really, really helpful to support that. So just, I'm always the sort of person that will be like, if I see somebody that looks like they're a bit on the periphery and don't really know anyone, to put your arm around them and just be like, hi, how are you doing? And I think that's just really important, I think, always to think about, because you never know what someone's situation is and if they know anybody, because that's my worst nightmare, being somewhere for a long period of time, not ever knowing somebody. And I think that's really important in the pandemic, just knowing your colleagues, knowing what the support systems they've got, and just having that in the back of your mind.
I love that. You're that girl at school where the new kid comes and you're like, you can sit with us.
Oh yeah, wasn't he? Oh God. And they were probably like, Sarah, no, I don't want to sit with you. Please.
I love that. We all need a Sarah in our life to just welcome us to the cool kids table. I love it. All right, so that's really good that you have the board of directors and there's good people around. But again, when it's just you and you're like, oh, I just need some time, how do you switch off? What does switching off look like for you?
I like to watch trash TV. It makes me feel better about my
Sounded
own
like
life.
a confession, didn't it?
Yeah.
Or bit of Married at First Sight, Australia.
Oh,
That is great. I've just found that and it's
Throwing it out there for you lot. Anything? It doesn't have to be TV. It could. The hiking sounds really good, actually.
That used to be my getaway before pandemic hit.
Right.
So the Alpine Society at uni, all the alumni go and help out with the med students when they go out on the trip. And there's usually once a month somewhere, wherever,
That's good.
from Wales to Snowdon to Lake, whatever. It was just, you get there Friday, just chill out, get some fresh air, come back, new person.
That sounds
recharged, ready to go. But obviously that went out the window.
Oh.
So looking forward to that again.
Have they brought it back yet? Not
Sort
yet.
of yes and no.
Right.
Bish.
Well, you can still do like the local park. Not really a hike.
I've got a park around the corner, so I'll go around for a little jog around there.
Oh, that's
And I think that's a real refresher, isn't it, when you go out for it, just get some fresh air.
Yeah, definitely.
Any other switching off for you, Sarah?
I just love exercising, going to the gym. As you know, it really clears my mind. And one thing I've got better at is working out what I need to do, whether it be a yoga session or whether it be like HIIT training. Because I found you go all the time. Sometimes if you're on an A&E job or you've had a really busy day in GP. So actually working out what you need in that evening is really important. So I go to the gym a lot to kind of de-stress. It's better for everybody that I'm around, I think.
That's good. No, that's good, because I definitely agree with knowing what you need, like yoga for a certain time.
Yeah.
You know, like you said, going all the way in with a HIIT.
If you've had a really stressful day and then you
Just
go
go
and do
home.
like a really adrenaline-filled session, then you're just going to actually make your day even more stressful.
Exactly.
So I think that's really important. And then love the outdoors as well, like Thuva, going for walks and things like that, which is good, just to get away.
Nice, nice. Okay, so let's talk about finance, moving into foundation year. Like, these all can be big, big things that can be really stressful for a lot of people. What are your top tips for managing money and also going into GP training? Like, how do you work out savings if you actually want to think about your future? How does that when does that come into practice and play?
Yeah, it's difficult, isn't it? Because you've gone from med school, you've had a grant, you're then earning money, you've got a month when you don't have any financial support, and then you get paid, and it's, oh my gosh, I've been paid. But I think the one thing that I wish I'd realised more is, depending on what job you're on, you're banded slightly differently, especially in training. So certain jobs you'll be have a higher income because you're working more out of hours, or you're working more unsociable shifts. So on those jobs, that might be the time to maybe put a bit of money aside versus other jobs where maybe you're being paid a little bit less, and that might be a little bit more counting the purse. I was going to say counting the purse strings, but counting the, I don't even know.
The pennies?
The pennies.
Yeah.
Saving money.
Yeah, around that.
So it is varied. I think Wesleyan have got loads of good advice as well on their website about finances and even things like getting a mortgage, because if you're locuming or in certain jobs, it's a bit more difficult, really.
100%.
To get mortgages and things like that. So that'd be a good source of advice for people, I think.
That's good. Again, booked and busy. You've had many streams of income over the years, Thuva.
I actually got myself sorted very early on.
That's good.
Because of responsibilities I had to. So day one, as soon as I found out I was getting a job, I got my life insurance and critical illness, all of that stuff in order. And then the other thing I think was a really useful thing is to stop and check every now and then is what direct debits you're getting out of your account, and make sure they're relevant and still necessary. Do that, I don't know, at least half a year or so.
That's a life hack.
That's an amazing saver. Then you'll find out what's not required and what's required. And the other good tip is, if you're spending money, have like another account, Monzo account or something like that, where you set a standing order, set 100 quid a month or 100 quid a week or so into that account. So you spend it, and you know when you need to top up that you're in naughty step.
You did too much that month. You did a bit too much.
But, you're self-aware what you're doing then.
That's a good idea.
And the other thing I think I would say is get on the property ladder ASAP. Get on the property ladder. Do all you need to do to get that sorted. As a doctor, getting a mortgage can be sometimes tricky, and Wesleyan was really helpful in helping me sort that. I will start planning for that, and I think that was something that you need to start thinking about, especially for the first house, because of all that hassle you probably get, it's probably the hardest, but also probably the one that's most supported by the government systems in terms of you having a less amount of deposits, no stamp duty and things like that. The sooner you do that, the amount of investment return, the return on investment you get from a house, nothing will beat that. Nothing will beat it. Yeah. So stop whatever you're doing, put money aside and get a house first. That's it, to be honest. And then you got to live life as well.
Okay, what are we talking about?
Busy and living life.
What are we talking about? Where we flying out to?
You got to celebrate now and then. So I think it's worth, giving yourself that space sometimes when you need it.
So do you I mean, this is probably pre-pandemic. Was you a big, I need a good holiday, I need to let loose a little bit?
It was for more of a weekend.
Okay,
yeah,
weekend is good.
Holiday is fine, yeah.
Yeah, okay, that's good
I'm very much like that. Save up money. There's one pot for actual savings, and one I've got a kind of a short-term savings for is my car broken down,
right?
That sort of thing, and then another pot which I know in my head that's for holidays, because for me I really like exploring, and that's something that though we've not been able to do it, it's something that we're lucky enough to have a bit of financial kind of finances to fund that, and that's what I want.
Something to look forward to.
I know,
because
you've got to have that in your mind.
Yeah. The little goal at the end of the year or end of summer. Yeah. Sham, how about you? So you're in the kind of middle ground position where you've started getting a little bit of change, but you're like,
Well, for me, I've always had a job since I've been 14, so I've always been okay with money, money coming in, savings and stuff like that. And then a good thing that came out of the pandemic is my cohort of students started working 6 months earlier than we were supposed to, so we started getting money earlier. So I've been able to try and save for a house.
That's amazing.
Emergency money, holiday money, although I haven't been able to go anywhere yet, but it's waiting.
Is there?
So
it's going to be a good one.
Yeah.
It's
good holiday, yeah.
Yeah, so luckily I've always been good with saving, but I think it's good to get that mentality, especially when you start getting money regularly and larger amounts of money than what you're usually used to. Putting things in the right places, fun money, money that you need for your rent, your home, bills, and then goals money. Yeah,
you just got to be realistic with it. Not everything can be fun money, or not everything has to be
saving
rent money. Actually enjoy yourself. So we've actually got some questions flying in. I feel like these are. We can come back to these later, actually, because I feel like we're in a good place with these ones so far. This is good. Expenses, professional expenses. So some of them are a must, some of them, you don't need to spend money on that. Do you have any advice?
Checking every 6 months.
He's like, Netflix gone, Disney Plus gone. What are there? Or let's talk professional expenses.
So I guess the ones that you will come up straight away when you start as a doctor is your GMC registration, your registration to be a doctor. That's a non-negotiable, and it is actually reduced at the earlier stages in your career because they appreciate that your salary is different to later in your career.
That's good.
And the other one is medical indemnity, so you need insurance to practice medicine, and that needs to be paid depending on what your roles are, depends on what sort of medical indemnity. So you'll have a certain one for the NHS, then have a separate one for my private practice, and different ones for anything else that you're doing.
Yeah.
So those are two vital key points, and I'm trying to think of it. I think is that.
Why are you looking at me?
I feel like you're cutting off the non-vital ones, so I'm just double checking.
You're right. The GMC is mandatory. MDU indemnity is actually paid for if you're a GP trainee. The rest of them have to pay, so you're covered. And so will it be when you're a GP. So that's one that you don't need to worry about.
Good.
The other one is your annual GMC membership we talked about. Is your BMA membership. That's up to you. You think about it. Obviously, my opinion is biased because I'm a BMA member, and then the college membership as a trainee, it's a must. You have to pay for it, and I think it's all advanced, isn't it, up front from the beginning? So you pay for it and forget about it. And then the other ones are come up and as and when they come up, really. Your exams, you'll have to put money aside for your membership exams. Probably not to think about for the first year. Just take your time to settle in for the first year. AKT and all the things will come in second year. AKT is not that expensive. The third year, RCA is a little bit more expensive, but you've got plenty of time to plan ahead for that. Don't worry about that. Apart from that, it's just day-to-day things, really. Just getting if you want, you can buy yourself kit, but you don't have to. The practice will provide you with a kit. If you want, you can spend some money on your revision courses and things. Again, these are reimbursed via student budget, study budget. It's a bit of a faff. You don't always get reimbursed. You have to be careful which one you apply for, which you don't apply for. Strict criteria is which one's reimbursed. So check beforehand if you're thinking of blowing big money and you want it back, or unless you're happy to blow that money. I know lots of people that spend loads of money on courses and go all out. All right, not everyone's got that money, but it's all right if you've got money.
There's lots of places to get your clinical professional development for
there's an abundance of resources.
Lower costs, and the other thing is any of the exams or memberships that you pay for, that can be added onto your tax-free allowance as well. So though you do have to pay for them, there is kind of like that tax break for them as well. So it's important that I didn't know about this in my F1, so I had to claim back in my F2 all the stuff that you just heard at that stage, because I didn't know about Wesleyan, I just heard through the grapevine. But I think there's some good stuff on their website, as I mentioned, that you can have a look at, and it will advise you on that, because many long calls to different people to sort out tax codes and tax breaks and things like that. So that's something important that you can claim back.
Good, that was really good advice. Sham, hope you're taking notes as well.
Yeah.
No, that sounds really, really good. That, just be prepared, basically. Definitely be prepared. Well, let's move on to professional and personal networks. You all sound like you've got really great networks. The board of directors is really coming in handy here. But how did becoming a doctor impact your relationships, whether that's family, partners, anything like that? Do you feel like, you've had to change how you communicate with everyone because of your schedules?
I think at previous events we've spoken about, like people's weddings, you'd be like, I might be able to be there, I might not be able to be there because of rotas and things like that. And I think as you go through, that's the brilliant thing about GP when you qualify. You can choose to do out of hours, and that's brilliant that GP does work out of hours. But if you do want to work certain hours that work for you, whether you're a mother or father, whether you're a carer, there is that flexibility there as well. And I think for me, I definitely see my family less than I would like, but that's because I'm in a different area, and I have a different support network here. So I think it depends on the area that you're in and whether that's your support network or not. So I think that definitely impacted it slightly. I've got a little niece, and I'm like, oh no, I don't get to see you as much. But I think now FaceTime, we chat all the time on FaceTime. We've spent a year and a half doing it anyway. So
We've changed.
It's changed.
Yeah.
So you're able to adapt to it, and I think as having a non-medical family as well, and non-medical friends from school, that's really helpful as well. Gives you a bit of normality. I do lots of my good friends are medics, and I do love medic chat, but you do need a little bit of a decompress sometimes, don't you?
Totally hear that.
Always.
Thuva, how about you? How have you balanced family and friends and all that kind of stuff?
Yeah, I think it's interesting, isn't it? Like Sarah, I think home's in Croydon, so I go back fortnightly or whatever, and I can get time to go back to see my old school friends, etc., etc. But again, I've got a good personal network here that are medic friends mostly, but there's still personal network rather than professional network. And of course, I've got my professional network because from all the roles I've done over the years, you accumulate loads of friends, and everyone progresses in their careers, and you progress in your career, and you look around and you see people in big roles now that that you used to work with you, and I think that's an asset to to what you gave back then. That will pay dividend now. So whenever there's a volunteer role coming up, just don't ignore it thinking it's not going to help me in any way. There's a return on that time investment. Do it with good intentions. It will pay back later. Don't do it just for the sake back. It will give back later. But I think that's paid a lot of dividend in the professional network. And again, these are part of the board of directors. When you're thinking about career advice and you want to think about this role, where to go next, you just you can have a personal chat with them because they're friends in some ways now rather than colleagues, and you can have genuine advice from them. This is what I was then, and this is what I did, and it worked out for me. It may not be for you, but try it. What's the harm in it? And they could say, have you ever thought about this role, etc., etc. Because they know what you were like. They know what you as a person. They know what makes you get go and what makes you not get go, and what will bore you. They can be honest with you. If they're friends, they can't be honest with you as colleagues because they have to be somewhat professional. So I think building that relationship is important. I always come back to relationship because that's what makes the world tick. Me and you could be on the same team, but if we're not friends and you're not invested in me, I'm not invested in you, ain't nobody gonna win that show. Because We're not there. We're not there for a goal. We're there because we have to be there,
Yeah.
and that's not going to happen. Same in practice with my team. You know, we're friends first, and then everything else comes first, second. Yeah, because otherwise, you know, I could tell you what to do. You could tell me what to do. Fine, but yeah, it's on the list of things to do. I'll do it when I need to do it because I've got a million other things to do.
Yeah.
But if you pull up my heartstrings and say, you better do this now, then I might be more inclined to do it because I owe you, or just because I genuinely want to do it for you. Yeah. That makes things happen.
Definitely.
And that's how you get things going in such a huge system as the NHS. I think one of the best ways it was described at one of the board meetings is bringing about change in the NHS is like turning a yacht around, not a yacht. An ocean liner, cruise ship around.
Worse.
Yeah. Turning a cruise ship around. And that's going to take a lot of manpower.
Yeah.
And you need those people behind you. Without those people, nothing's happening.
Yeah.
The other thing you can seek as well is mentors, not just in your chosen career. So I've got GP educational and clinical supervisors. It's mentors that are doing something in the future that you want to be involved in. Right. So one of the things I did when I wanted to get involved in sports medicine is reach out to local sports medics. Yeah. Just literally when you message someone on LinkedIn, it's only a few characters that you can put in there, and actually just messaged a few people, and a couple of them got back to me, and that's how those relationships over the years have developed, and meeting them in person, etc. So getting mentors as well in whatever specialty you want to go into, or somebody that you look up to, is always helpful because people want to give back.
100%.
Yeah. And be a mentor and impart knowledge. It's flattering, if not anything.
That's the word I was looking for.
Yeah.
Flattering. Like,
Isn't it?
Who, me? Of course I'll help you, darling.
Yeah, exactly. And so yeah, I think that's a really good way of doing things as well.
Yeah.
And spot on there, LinkedIn is a vital thing. If you're out there, get on it now.
I'm on it.
As in,
Hey, I'm ready.
Good,
I got
good.
this.
I think, again, get yourself to events and things. You know, the more you're out there, the more people see you, the more people know you, the more people that will provide you with opportunities. Yeah. That's how the world works, unfortunately, as much as we don't want to see it, believe it.
Sham, how about you? How has, and are you prepared for the next step of, taking on the GP practice, having to not be able to be as flexible as you once were as a young medic?
Right now, I'm not very flexible. My rotas are absolutely insane. So the fact that I could even make it today is an actual miracle.
Oh my God,
if you ask me, I can never go anywhere. So at the minute, my rotas are quite mad. Wow. So I'm looking forward to a bit more flexibility actually going forward. Well, I'm hoping to at least. Yeah.
Okay, wow. That's, I mean, it sounds like you're already in there. Like, you're a busy bee as well. Wow. Okay, so one of the big draws of a career in GP can actually be the flexibility, as you just said. Have you ever been tempted to work abroad or take a career break? This is probably for you two mainly. Have there been times where you're like, actually, let's go somewhere else, or let's actually, are sabbaticals a thing?
Yeah, they definitely are, and you can tailor them around you. So for me, I did an F3 year, which isn't a thing, but it is a thing. Okay. So you do your foundation year 1 and 2, and then there's an opportunity to take a year out. For me, there was a number of reasons to do that. I'd finished a really busy job. I felt super burnt out, and I was like, do you know what? I really need a bit of space and a bit of time to do a role that I can do everything else that I need to do, social life, family, etc. But the other reason was I had absolutely no clue which career I wanted to go into, and I didn't feel like I had the time, because the shifts are so busy, to actually get experience necessarily in the fields that I wanted to get involved in. So that was really helpful. So though I didn't go, I did a little bit of travelling, but though I didn't work abroad, that was a really good way of me kind of having a break out of training, getting some experience, and then really making an informed choice to go into GP, because it was something that I really wanted to do. So for me, that break was brilliant.
Thuva, do you see yourself taking any career breaks or working elsewhere?
So that's an interesting question. I did think about going to the English countries, one side, TCTs last year, and just doing a bit of travelling, New Zealand, Australia, Canada, whatever, seeing what it's like there. But would I stay there? Probably not. Home's home, isn't it? You're just comfortable, you understand society as it is here, whereas there's a different way society works there, isn't it? You've got to resettle, re-understand, re-acquaint, re-network. It's just going back to square one, isn't it? So I'm not a fan of that principle. So for me, it's not it. But the other question is career break. Have I considered it? Yes, I've considered multiple times taking a career and going, working for pharma or something like that. But I guess the right opportunity hasn't come my way yet. It might do. If it does, maybe I'll take it. But I've got the flexibility. Every day is different today. I don't think any job will give me that flexibility compared to GP. No job in any high-paid environment can give that responsibility without a huge amount of stress. Don't get me wrong, I'm stressed with the job that I got, but that's a different cup of tea altogether. And you're doing one thing all day, 7 days a week, a whole month, whereas now I'm doing many other things on the side, and etc.
Sham, you gonna venture out of South London?
The M25.
We'll see about that. But do you know, so because of my year group, because of COVID, we missed our medical electives, which is where you go abroad, you experience health systems abroad. So we missed that because of COVID. You obviously couldn't leave the country. So I think at some point, I do want to take some time to go and be able to see, health systems in other countries. I had planned such an amazing elective in the Caribbean and the States.
Oh my God.
COVID came down. So I want to do that eventually, but I don't think working outside of the NHS long term is for me.
Fair enough. Oh, COVID, you really done a number on us.
No idea.
Literally. Well, we are getting closer to the end, and there are a few bits that I would love to just get. These are inspirational questions. So, who are your GP inspirations, first of all?
Oh, that's a tough one.
I know.
Are there really? Actually, are there GPs?
I have two.
Oh, okay, go for it, Sham.
There's these two ladies that I really look up to, Dr. Margaret Ikpo and Dr. Amon Imohi. Amazing GPs, black women, do so much for the community. Role models, yes.
Yeah, that's good to hear.
That's amazing.
Any GP inspiration? I guess it is a tough question because, not all GPs are like celebs, or do you know what I mean? It's not like I can say Oprah, but who's your Oprah?
So, I'd say Prof. Nick Harding is probably one of my mentors because I've had the opportunity to interview him and see what he's done in the time that he's done, and he's one of the he's the Chief Medical Officer for Opros Health, who are a super federation of GP practices across the country, and he was formerly founder of Modality, where I work at the moment. And he's done great things. He's been advised for NHS England and numerous other things in his time. The other one I'd say is Aman Arora. I think he's a bit of a legend. He's set himself up really well in terms of what he does. He's really passionate about medical education, and you just see it in everything he does. And he's everywhere. And he's a true.
So there are celebrities.
Passionate about things.
GPs.
There are some celebrity GPs. Yeah. Let's not go down that road. But yeah.
They might not call themselves that, but there we go. We're calling them that today. Sarah.
I would say there's a gentleman called Dr. Dale Halloran, who basically is part of a clinic Prof. Belly runs in Birmingham. It's all looking into concussion management, and they're doing loads of stuff for sport, but also those who have received head injuries and just incidents and accidents to rehab them. And they're developing a saliva test at the moment, which could just diagnose concussion.
Wow.
So avoiding people potentially from returning to work too early, leading them to long-term complications. So I think those sort of kind of GPs with a specialist interest are fascinating, and that's obviously a niche that I'm really interested in.
That's amazing. Sounds like they're working on a brilliant...
Literally is like a lateral flow COVID test, it will be like. Yeah, it's amazing.
That is very much amazing. So, okay, we've been talking about why GP. So if you guys could each give a 30-second elevator pitch of why you, or maybe, if you had the opportunity to convince the masses why they should join, what would you say? So let's start with you, Sarah.
So someone much cleverer than me said to me that if you look at the consultant of your speciality, do you like what they do? And that really stuck with me when I was choosing a career, and I looked at different careers, A&E, orthopaedics and GP, and I looked at what the consultants did as a GP. They saw patients, they were able to have flexibility, and they were able to look into slightly different career types and have a portfolio career. And that to me, I just thought, wow, I could be doing that for my whole life and not only have one specialist interest, but could be an educator. Yeah. I could be doing lots of different things. And for me, fitting that amongst family commitments, I just thought, gosh, that's going to be the career for me. So if you want flexibility, the ability to have a business mind and be able to see your family a bit regularly, then GP would be the one.
That sounds good. Thuva, how about you?
She said it all.
So glad I went first.
again, similarly, the reason I chose it is fundamentally the flexibility it offers you, not just in terms of the working lifestyle, but in terms of opportunities, and the sky is the limit. There is nothing you can't do as a GP anymore. So that's one. The other thing is, of course, again, being open-minded and being able to enact change within your practice that you want to do the next day. There is no monumental amount of paperwork that you need to get through, get signed off in a trust before you can buy a new chair. Because that's what it is in a hospital. Yeah, you just go and buy a new chair. Yeah, that's what you can do in general practice. And that has direct impact to patient care.
Right.
Yeah? On a day-to-day basis, you can change things. Therefore, you can change the way of healthcare and the face of healthcare. And the world is your oyster.
I'm literally so shocked that you can't order a chair in a hospital. Sham, how about you? What's your elevator pitch for future GPs?
I guess it's difficult because you guys both said everything. But for me, I guess it's the complexity and the easiness of conditions that you can see, treat and discharge, but also the patients that you can bring back and see from the beginning of the story to the end of the story. You're involved from, you know, babies to old people, you can see them all, and your day is so varied. That's what I'm looking forward to. Roles that you can have in leadership, medical education, that variation in not only your clinical life, but your work as a whole. I think if you want anything like that, choose GP.
Jeez, that was nicely put.
Choose GP, yeah.
Hashtag choose GP. Thuva, did you want to add to that?
Yeah, I think continued care is a big thing, isn't it? Only in GP can you see patients and build rapport. Even today, I know it's not as prominent as back in the days where, you know, you need the whole family inside out.
Yeah.
But even today, the patients come back and they look for you and ask for you directly. And that's how you know you're making a difference.
Yeah, I actually can testify for that. I've got testimony. Yeah. My doctor, he always gave me, because I'm Nigerian, he's Nigerian, he always like, hello, Ugo. That's my Nigerian name. It was very personal. Yeah. And it was just like, he saw me from a baby to adult, and I'm just like, that's my guy.
Yeah, exactly.
That's mine. So I love that you guys are building these amazing relationships and businesses and practices and future practice. So thank you so much for joining us. This has been Wesleyan The Next Step. I hope you have taken in all of this. I hope you had a pen and paper, because these guys were dropping gems. Thank you so much for watching. Please do check out the socials at the Wes Next Step on Instagram. Check out the website as well, thenextstep.wesleyan.co.uk. and rcgp.org.uk. I've been your host from London. Virtual round of applause for our incredible doctors. Thank you so much. Good night.